Hello everyone. We're honoured to be here today, not just as a representation of our own charities, but as mothers of Charlie, Matteo and Edward, each living with MECP2 duplication syndrome. Like many of you, we've experienced the same journey. We know firsthand the challenges, the hopes and the resilience it takes to navigate life with MECP2 duplication syndrome. Today, we're especially excited to share some news with you about the launch of the Global MECP2 Duplication Alliance, an initiative built by families for our global community. The Global Alliance is a groundbreaking initiative designed to support families, clinicians and researchers in the fight against MECP2 duplication syndrome. This alliance brings together a coalition of organisations working towards a common goal, improving outcomes for those affected by this rare disorder, and we'll be discussing who we are, what we're doing, and why the Global MECP2 Duplication Alliance is so important for this community. Katie, can you tell us about the Global MECP2 Duplication Alliance?
Sure. All right. So we're talking about the Global Alliance being a collaborative network of advocacy groups, along with researchers, healthcare professionals, and industry partners. So we need to bring all of these people together into one group to work together and improve the lives of people affected by MECP2 duplication syndrome. That's all of us here. So at its core, the Alliance is powered by the 6 major charities that you see up here. So the MECP2 Duplication Foundation from the US, MECP2 from Austria, MECP2 Duplication UK, right here, MECP2 Duplication Syndrome Deutschland from Germany. I know I met a family from Germany earlier, and yes. And then MECP2 JP in Japan. So they weren't able to send representatives, but I know they're going to be watching this video afterwards.
Absolutely.
So, and then Murada's Blanc from Spain. So by pooling expertise and resources, we're going to be driving progress forward for those living with MECP2 duplication syndrome. And so the working group is uniting stakeholders around, can you click me?
It's not working.
No. Oh, it's still
Sorry,
not
there was
working.
some slides, but we've lost them.
Okay,
So.
we lost the slides, but I'll just talk through them. So we're really focusing on research, care, community, and awareness, all with the goal of improving outcomes for patients and families. We all want change. We all want it now. We just heard that in the last presentation. There's so much enthusiasm, I think, and hope in this room, and we just want to keep driving that forward and make meaningful progress faster and more effectively than any single organization could ever do alone. That's why we're all coming together. So, Caroline, can you tell us more about the strategic priorities?
Yes, of course. Happy to do so. So, as Katie just said, the Alliance has different missions, and these are also our strategic priorities. So you can see them here. The first one is advancing research and innovation. We are in a very, very lucky situation for MECP2 duplication syndrome, for a rare disorder, to have 2 clinical trials ongoing. But with the Alliance, we want to have more. We want to be here to help further development of clinical trials, next steps. And also, we want to be here together to look for potential new treatment options and also accelerate their progress. The second strategic priority of the Global Alliance is to improve care and access. I think we heard this morning from Davut. We also have all lived how difficult it is to find doctors that are experts in our area. And the idea of the Global Alliance, one of the big priority is to define centers of excellence where doctors are trained, they understand MECP2 duplication syndrome, they would be educated to be able to support families as soon as they come to their clinics, so that no family has to struggle with MECP2 duplication syndrome alone. Together with that, we also aim to raise awareness and increase knowledge of public knowledge and also professional knowledge, therapists, again, clinicians, to be able to support families. And both of these priorities are actually linked, because with this, we also want early diagnosis, and we want the Global Alliance to be present as soon as the family receives a diagnosis. This is very important for us. And finally, as you heard already, the Global Alliance is here to have a strong community because we truly believe that working together will help, in the end, all families. So, Helen, can you tell us a little bit more about what the Alliance can do for families?
Of course, yes. We see several key benefits to the community. First of all, greater collective impact. By this, we mean by coming together, we will create an amplified voice that speaks loudly and clearly to raise awareness, to influence policy and research, and drive change. By working together, we can avoid replicating individual efforts and be more effective. This means less fragmentation and more coordinated actions that benefit the community. Access to shared resources is another one. Being part of the Alliance means we can offer a collective set of resources to the community, allowing for a more vetted and reliable information to be shared. Thirdly, to expand funding and partnership opportunities. The Alliance opens doors to collaborative grants and shared sponsorships. This increases our ability to secure funding and participate in joint initiatives that would otherwise be out of reach, which can mean more resources for research, advocacy, and clinical care. And finally, the stronger policy, research, and advocacy influence. By presenting unified messaging and coordinating efforts across regions, the Alliance can push for a greater recognition, collaboration, and support. Our collective reach increases the entire community's influence, whether we're working with partners in research, policy, or industry. Katie, can you tell us about the importance of the Global Alliance?
Simply put, like we've been saying, it's important because the needs of the MECP2 duplication syndrome community are so big that we have to go big. So our voices are stronger when we collaborate and speak as a group. We know the challenges that families face. We're all families, and finding, from diagnosis to expert care, the complexities, like you saw, of participating in the research process. We want to be here as a resource, and these are all really big and overwhelming, and we want to make it less. So, yeah. All right, Caroline.
Yeah, so as a conclusion, I want to say that advocacy groups are still in place. Local advocacy groups are still in place. They still have their mission. They still have events, local events. But from raising awareness to improving care to accelerating research, we want to work together to be stronger. So as we are shaping the Global Alliance, we invite you to support it, to follow it, and to join us. And yeah, more to come, exactly. We'll be sharing news in the next months, and we're very, very excited.
Absolutely. Thank you both. Thank you very much.
Thanks.